Hi everybody, hope everybody's okay. So in terms of RITA in Dudley, specifically in Dudley, we had a standard rate for residential and nursing homes in terms of placement rates. We saw the availability of those placements were reducing, specifically around supporting people with dementia and complex needs. So providers were requesting enhanced rates, top-ups, additional one-to-one support payments. So we started to explore RITA with My Improvement Network. Why did we choose RITA? It was being used in our Dudley group of hospitals. So we were able to visit Russell's Hall, speak to staff, see patients in terms of experiencing RITA and what was the outcomes. So that's why we went with RITA. So in terms of Project RITA, what we hoped was to show how the digital system could support and improve care for people, specifically with dementia and challenging behaviours, through empowering stimulation and engagement. And what we wanted to try and get to was these I suppose stopping the request for one-to-one support and the care team having the opportunity to support people in much more of a cohort of residents as opposed to that one-to-one. When we'd seen RITA, we could really see how it could innovate the way in which we provide services. So replacing very traditional models of care and behaviours, in terms of challenging behaviour, needing one-to-one, to actually give people another solution. But what the evaluation did was paint a much richer picture for us. Okay, so what we did in terms of the project, we arranged awareness sessions with our social work assessment teams, with Fiona from My Improvement Network, to demonstrate the outcomes that could be achieved with individuals, their carers, and critically as well for the organisation, because we did have a mandate to make better use of its resources. So if funding applications came to panel, then we'd challenge those applications and ask if the worker had trialled RITA with the individual, is RITA within that particular home, etc. Because that was also challenging the current way in which social workers was organising that care. So RITA was made available. So we initially invested in 13 units, but then we soon invested in a further 15. We made RITA available in a pilot group of residential and nursing homes. It was also in situ in our dementia gateways, which provides day opportunities for people with a diagnosis of dementia, within our Unicorn Centre that provides support for people with learning disabilities, and also within our carers hub at Queen's Cross. And Queen's Cross is a facility that supports younger adults with disabilities. So how did we evaluate? So each site, they completed comprehensive feedback forms. So the information that you're seeing is from homes themselves, and they also, in terms of how they report, to CQC in terms of number of falls, etc. We got that qualitative and quantity data from the homes themselves. So this is what the form looked like, and this is how My Improvement Network got that data and then pulled the individual case studies together for each home. So these are a list of the outcomes that people, the homes reported on. So this came directly from the home as well in terms of the list of cost savings. We badge them more around cost avoidance. Fewer hospital admissions reported across all sites. They all fully embraced RITA in terms of the sites that piloted RITA, and we were being contacted by other providers across the market to say, can we have RITA? We want to use RITA. We were at first, when I said around people bringing panel requests for funding, we had someone in a very high cost placement, and we worked with a particular home and said, through the use of RITA, could we look at you providing care to this individual? And they actually saved 33,000 bottom line for us on that case. They were able to manage the individual needs of the person. And what the homes manager then reported was they were able to offer that to another 5 residents in a similar situation. But what was highlighted in Dudley from the care home managers was there were less, they all reported less one-to-one resident-on-resident safeguarding incidents. So that came through in terms of our evaluation. And then with regard to falls, one home reported a reduction of 66% in falls and another reported 33%. But we also saw less requests for that one-to-one, and when people did request one-to-one, we said, have you tried RITA? And also to the social worker coming for additional funding to say, have we tried RITA? What was the outcome? We potentially would fund the one-to-one care in the short term, but encourage the social workers and the care teams, please use RITA. Let us know what the outcomes are. And so we had a tool, if you like, in terms of that we could access to improve people's care and support in the home. One home reported a saving of 20 grand per annum. So instead of saying somebody's needs are changing, behaviours are changing, we can't manage them anymore, that, in terms of everything that goes with that for the individual about moving home, but also, from a home's perspective then, admitting someone, doing all that assessment, that's what they reported in that situation. Project RITA won't happen. It's got to be delivered in partnership with your assessment teams. If it's in adult social care or in a clinical setting, we've got to get buy-in from our staff. We also had the involvement of our telecare service, so they were able to be My Improvement Network were great. They'd go out, they'd raise awareness, they'd do training, they'd do retraining, but we'd also got Dudley Telecare Service that we trained as well that could offer that support as well. Okay, so that's just around service improvement and transformation. So the project enabled all sites involved to improve outcomes. This is a tool, I think, in terms of one of a number of tools. And we did some awareness sessions, and one care home manager said, in terms of people's behaviour, meeting their individual needs, different situations, it was always then, they'd be able to access RITA very quickly. Have we tried RITA? So they could initiate it when required with anyone very quickly. Our plan was, okay, we've had the pilot, we've extended it slightly. We want RITA in every home in Dudley. Hadn't got the funding. Let's raise awareness. Let's see what the opportunity is. Can we do some joint funding with homes? In terms of being able to really have that sustainable model. And then we were hit by the pandemic. So with regard to, it was just putting it into context really of our whole digital journey in 2021, which I think you've all gone through with COVID. So we were able to roll out to 34 residential and nursing homes. We were the local government chronicle. We were finalists for digital impact and service model categories. In COVID, we implemented an adult social care IT system. We worked in partnership with commissioners, providers, the Carers Hub, and we RITA was the start, but developing digital pathways, so a range of technology. We procured more tablets, the Skype station at one of the homes, and also with regard to, I think we hit the BBC, and it was how residents were able to interact with their loved ones. There are some of our priorities. And really moving on to planned initiatives, and the reason why I've pulled this slide up is that the Carers Network with Public Health, through working in partnership with Just Straight Talk, we're looking to support individuals to develop skills through a designated digital buddy, so for informal carers and people over the age of 60. And where we're going next is that the Carers Network want to pilot the use of RITA in the community. So with informal carers providing support to a person with dementia. So that's going to be one of our, next priorities as well as building on what we've already got. So for us, it's about doing different things. So that's our feedback from Dudley, Mike.